AskReddit by BabaHippo01. Medical professionals of Reddit, have you ever had a patient so lacking in common sense you wondered how they made it this far? If so, what is your story? There is a reason the instructions for prescription suppositories say unwrap and insert and not just insert. Do not take orally. Physical therapist had a patient with neck pain and spasms, also complained of anxiety and heart palpitations. Asked about caffeine intake and patient revealed drinking an average on 15-20 cups of coffee daily. One of my dumber moments in my younger years. I'd stay up all evening drinking a pot of coffee and chatting with friends. Later around 4:30 AM. Why am I still awake? I work in home health. At my last job, I had a lady call saying she was returning my call specifically. I don't recall her at all, and when I check for anything on her, it shows we have never received a referral or anything for her. Which I tell her. She gets mad and starts screaming at me, won't let me get a word in to tell her to call the discharge planner at the hospital. Like a good 8 minutes of her screaming at me, calling me heartless, and idiot, you name it. Whatever, it's slow and these calls are usually good for a laugh. She takes a breath. I say, Mom, I'm not sure who called you, especially since we haven't heard of you before now. She interrupts with, no, it was definitely you. You said your name was Sheraton and you were calling from Advanced Home Health. We have detected the problem. I tell her I see what's going on. You accidentally called Amber H. I was not expecting that one. Had a buddy who was an EMT. He was called out to location for a gunshot wound. Apparently what happened is a father was mowing his lawn when he accidentally touched part of the mower near the engine and burned his hand. He got mad at the lawnmower, pulled out his pistol, and shot it. The bullet ricocheted and hit his son in the leg. My brother shot himself with a ricochet hunting one morning before school. Dad had the doctor write that he was missing school and later paid due to gunshot wound to the leg, in his note. That note is now framed and hanging in the living room. He's oddly proud of it. No clue why. Gun safety is a huge deal to him. We weren't even allowed to aim Nerf guns at people or pets. Rurally doc here. 35-year-old female walks in with right-sided jaw neck swelling. I think it happened because I ate some meat yesterday that my body is reacting to. 10 minutes later, oh yeah, and I accidentally swallowed a bee and it stung me in my mouth right before this happened. Sorry, I forgot to mention that. A friend of my mother's died from a wasp that got into his drink. He swallowed it, it stung him on its way down, and despite having no allergy to stings, the swelling was enough to close off his airway. Pharmacist here. I had a woman bring in a literal sandwich bag, unseparated, which she kept all her meds in. She needed help seeing which meds she was low or out on and asking different questions on the medications. When she pointed to an apical stating it was her blood pressure medicine, I immediately became concerned as to why pet medicine was in her bag. Also why she is mixing all her meds in a bag in the first place, only to find out that she had been throwing her pet's med inside her bag of medicine. So Lord knows what she's been giving her dog or taking herself. I immediately stressed how important it is to keep medicine in its original container to protect the medicine and herself and to know the directions of how to take it. I've seen her a few times since then and glad to see she has since taken my advice. But how any pharmacist or doctor hasn't advised her on this before is beyond me. Not me, but my mother would pick up shifts as a nurse sometimes in labor and delivery, and she had met a handful of women who didn't know the baby was going to be coming out of their vaginas. Like no clue. My mom usually said something like, how you got it in is how it's coming out, honey. This was the late 90s, early 2000s. I'm a social worker and one of my clients literally kept getting pregnant over and over after having kids. And I had a frank conversation with her about birth control or getting her tubes tied because she kept going through horrific births only to get her kids taken away, and she actually said to me that she didn't know that birth control or safe sex would save her from getting pregnant. She didn't realize that sex equals pregnant because she was sexually abused as a child and her father told her that she could only get pregnant when she's in love, and she had never been in love, so she didn't understand why she kept getting pregnant. Sex was only pleasure for her, so she didn't realize that was what was having her get pregnant. Edit, typo. Not me, but my wife, who is a vet, had a client who got mad at her because he didn't realize that once he neutered his dog that he wouldn't be able to breed it. As someone who worked at a vet office, I am completely unsurprised. We once had to explain what smegma was to very embarrassed owners of a new puppy who brought him in for discharge around his penis, not to mention the countless people who bring their cats in asking about a lump only to be told it's a nipple, and then you occasionally get the inevitable "but he's a boy" and have to explain that male mammals have nipples too. Like, mom, you are married. Have you never noticed your husband has nipples before? I miss working there. Had an 18 or 19-year-old girl come in my ER with some complaint that required an x-ray. It's standard that we do a urine pregnancy test prior to imaging on any female of childbearing years. She insisted she'd never had sex and there was zero possibility of pregnancy. We did the test anyway and it resulted that she was pregnant. We did a blood pregnancy test to confirm the result, since she insisted she couldn't possibly be pregnant because she'd never had sex. That was positive too. We gave her a few minutes to herself to figure out what the hell happened, and when I returned to check on her a short time later, she asked me if she could get pregnant even though her boyfriend didn't go all the way in. She 100% believed that long as his penis wasn't entirely in her, it didn't count as sex. It took nearly a half hour of explaining reproduction to her for her to understand that whether it's... What do you call guys that use the pull-out method of birth control? Fathers. Had an adult male patient who needed a Foley catheter. His mother was in the room, and they both lived together in the backwoods of TN. I informed them both of the order for a catheter, how it works, and why it was needed. His mother stated, "Well, he's still a virgin and I'm not sure I'm comfortable with his virginity being taken in a hospital." I hope that was just a joke. Hell, I'd tell that joke. Once had a guy come into the emergency room because he snorted a random white powder found in a plastic bag left on a random bench in the middle of a sketchy park and started feeling suicidal. Are you sure he wasn't suicidal before snorting the mystery powder? M's here. Had a diabetic in his 30-40s who refused to take insulin since 2012. It was 2020 at the time. When I took his blood sugar is only read as high, meaning it was over 700 for glucometer to not read it. Upon seeing this, he asked me if that was high and then went, "Is this cause of all the ice cream I ate?" Played Facebook Messenger video with his girlfriend the entire time. Met him later on the parking lot after he got discharged, and it took this man less than 50 paces from the ER door to rip off his bandage covering his IV and play with the IV wound until it started bleeding all over the place again. Knocked on our ambulance door and asked for a band-aid to fix it. We had to walk him back into the ER and bandaged his entire arm with gauze so that, hopefully, by the time he got it off it would have clotted enough for him to not end up exsanguinating himself. I had a guy once stop me to ask me a question. Young, early 20s, tells me he's a diabetic but he doesn't ever check his sugar or anything. And I have a weird tingling in my feet. Is that a big deal? Yes. Yes, it is. I was using meth for weight loss, have heard a few times actually. My sister told me a story of a woman with chronic blisters and lesions on her lips. They couldn't figure out what it was for weeks. It would heal and come back. Heal and come back. Turns out she would jam out on like 3 bags of salt and vinegar chip a day for weeks at a time until the sores hurt too bad to continue, then she'd go to the doctor. I eat S and amp V chips till my tongue is numb and I thought I was weird for that until now. This happened in med school on my OB-GYN rotation. Patient, who's the baby gonna look like? Me, what do you mean? Patient, well, is it gonna look like the dude who got me pregnant or the guy who's been nutting in me the last few months? Me, Utterly speechless. The baby should look like the people who conceived it. This person is now a parent. Edit. Fixed a typo. Nutting in me the last few months. Not a medical professional, but I used to volunteer at a free medical clinic to take vitals and histories. A woman came in with pneumonia and wanted to know why her normal treatment of drinking half a bottle of Listerine and smoking a pack of cigarettes a day wasn't working. I asked why she thought smoking was good treatment for a lung infection, and she said, Indians used to purify the ground by burning all the weeds away before planting, so I'm smoking to purify my lungs. I left that one to the doctor. Had a patient come in for facial burns because he smoked while wearing his oxygen, twice, in the same week. Just had a man die to this in March. https://www.wb.tv/023/208/deadly-main-fire-cause-be-white-man-smoking-while-accidental/ He had burned down his home the day prior and then proceeded to burn down his friend's home and die. Thankfully the friend survived. Pharmacist. Don't even know where I would begin for some of the ridiculous situations I have had. Up there however has to be whenever I had a lady swallow a full box of suppositories and came in to complain that the issue has not cleared up and the medication tasted bad and was hard to swallow. Do sometimes wonder how people put one foot in front of the other. Deleted. Vet Med here. We get a lot of patients who need to go on medications for a wide array of persistent problems, and these medications keep them under control. So we often get ones with thyroid, diabetes, heart issues, etc. and start them on medications. The patient starts to do great, comes in for another recheck, and is awful. We ask the owner if they are still giving the med. Nope, they stopped it cause they were all better. We fully educate the owner, go over medications, and give notes on what to do, and they still do this. My dad is like this. Won't feel well, goes to doctor, gets prescribed a round of antibiotics, even if it shouldn't be treated with antibiotics, takes them for a week until he feels better, stops, then wonders why he's not getting better anymore. And this man is an engineer. Former vet tech. Had a woman scream at me and my vet for telling her it's the law to have your dog vaccinated against rabies. She said the rabies vaccine causes autism in dogs and makes puppies stupid. Side note. 3 weeks later her puppy died of parvo. She got another one immediately after and did not clean her home. 2 more died in the following months. Animal control and the city had to get involved. That's freaking sad and anger provoking. I hope she was banned from ever having an animal in her possession again. My dog is a parvo survivor. My Sil is a veterinarian, and she saved him. He just turned 17 and still doing great. Addition. Unfortunately, my dog had a recurrence of losing control his hind legs. He was in much pain and I made the very hard decision to have him euthanized. He crossed the Rainbow Bridge on Thursday. ER nurse with 7 years experience. The list is nearly endless. People with massive burns because they smoked in bed is not as rare as you'd think. But the one that got me the most was a guy who came in for chest pain and fatigue. EKG revealed he was having a really bad heart attack. Activated our cath lab for emergency stents to hopefully save the guy's life. They almost always access the patient through the groin for the procedure, so one of our jobs in the ER is to shave the patient's groin to prep them for cath lab. We get the clippers out, we don't use actual razors anymore, and informed the guy we needed to shave him. He refused. No problem, we will let cath lab do it once he's knocked out. Nope, guy refuses to sign the consent for the stents because he doesn't want his pubes shaved. After trying to educate him, pleading with him, and contacting every goddamn lawyer the hospital has, the guy signed himself out AMA and went home. He would rather die than have his curlies shaved. We looked up his address and we weren't the closest hospital, so if he died at home, medics would take him to a different hospital. Doubt he survived the day. I don't know if cleaner in a hospital counts, but this one time I got to work early on a Saturday morning and we immediately received a request for help from the ER and got sent over by my boss. When I got there, the first thing I heard was yelling from this guy behind one of the curtains. He was shouting at the nurses, "Don't touch my penis," and I didn't use any drugs. Then I smelled iron in the air and then I found out there was blood all over the hallway, handprints in blood against the wall. Almost the entire floor was covered in blood with actual puddles in some places. What happened? The guy pulled out his catheter, causing arterial bleeding, and decided to run away from the nurses who were trying to help him. It seems like he lived through that. I never seen that much blood before that day nor after. Reading this brought pain. I'm squirming in my chair at work thinking about ripping out a catheter like that. Literally yesterday. Consumed 8 cans of Red Bull in a 2-hour time frame. Presented with palpitations and severe chest pain. I have heard a story about a patient on whom it was impressed that she couldn't miss her fractions of radiotherapy if she was busy, and to inform us if she couldn't make the appointment. She couldn't make it. So she sent her twin sister to receive the radiation therapy in her place. She answered yes to all the ID questions. Had the same birthday, etc. It was noticed when radiographers had trouble matching her to the CT. Because the CT was of a person who had undergone a mastectomy. Whilst the patient still had both breasts. This, many years later, is told to new staff during training about the importance of ensuring correct identification, because you would be stunned the number of people who try to skip the queue. The number isn't high, but it isn't zero. So, you're lactose intolerant? Yes. And you knew this before? Yes. And you drank a milkshake? Yes. What size? Large. The rest of the night was the kid screaming and groaning in the ED waiting room. YOLO. Lactose intolerant milkshake enjoyer. I worked in cancer research surgery a couple years ago. There is a good amount of people who will refuse to have a small removal surgery because they think holistic medicine or praying it away will work. They always come back and we always have to remove so much more. One time a patient had a melanoma on their calf and the doctor wanted to do a simple wide excision, but they left because they wanted to pray it away. Came back a couple months later because it got bigger and we had to amputate their leg. Pretty sure they had positive lymph nodes at that point too. I found a spot on my leg, sent a picture to my GP. He had me come in. A dermatologist removed 3 spots, 2 were nothing. The lab work on the one on my leg was maybe. Another dermatologist meeting, he cut more of the skin off and sewed me up. Lab came back negative, all clear. I'm really happy I had it done, because the dermatologist checked me all over and we took off the maybe. I don't worry about the spots anymore. Work at a vet clinic. We get a lot of this sort of thing, oftentimes with diabetic patients. One of the worst I've seen was an older owner come in with their extremely overweight, diabetic dog. Owner says the dog has been slow, tires easily, and has been flopping around, which is odd for her. Doctor checks her blood glucose and it is so high, it is literally off the charts. Normal blood glucose for a dog is around 100 or so. This dog was beyond 1000. We ask the owners how it got so high. Was she eating? Clearly she was, because she was obese. Were you giving her the insulin? The owners proceed to say that they think she's probably fine without it. She's a strong and hardy dog. Mom, your 9-year-old 80-pound Dalmatian is currently half alive on the floor because you don't give her the insulin. How they kept that poor dog alive that long was astounding. I worked for an OBGYN who had a patient he prescribed vaginal suppositories for. When she complained of no improvement, she came back in for another exam. He found 7 foil wrap suppositories in her vagina. As a pharmacist, everyone who comes in to buy homeopathic crap, especially for serious things. Once a lady came in with a prescription from the dentist for some heavy antibiotics and painkillers due to an infection that threatened to damage the jawbone. When I asked if she knew how to take them, she went, "Oh, I'm not gonna take those, they'll go right into the garbage. But I gotta buy them so that my dentist is happy. I'll rather stick with, insert name of homeopathic crap here, instead of poisoning me with some devilish chemicals." Throughout the years I've learned to just shrug and accept those Darwin Award candidates instead of arguing with them. Just infuriates me when I see that they've got children and pets. Why go to the dentist at all? When I was in the hospital as a patient, there was this one guy in the ER who really wanted to step outside to smoke. The nurses pretty much belted him on the table and yelled at him that he had complete kidney failure and they need to treat him immediately or he will die in the next 20 minutes. To their dismay, he didn't listen and tried to vehemently free himself and go outside and smoke. He was in his 30s. It is a mystery to me how this guy survived that long. I couldn't think of anything, but you just reminded me I was in hospital and while being assessed, I found out the guy in the bed next to me had been hit by a car. He had been drinking. His English wasn't great, so every conversation was at volume 11. X-ray comes back, his back is broken. They start getting him ready to be transferred, but the receiving ward was too busy, so he's stuck in a bed being told not to move. Nurse turned her back and he got up, got his cigarettes out, started walking for the door and fell over. Not like oh silly me, I appear to have lost my balance, full on ate the deck. I would swear that he bounced. The whole fucking room, staff, patients, visitors for about 10 seconds was convinced he'd severed his spine. Dude gets up with a jolly smile on his face. Nurse tells him in full on mum voice to get back in the bed. I work in clinical research at a hospital. Basically, for patients who have cancer and don't have other standard of care options, clinical trials, experimental treatment, are a viable option for many. Some people have a negative view of research, but it's highly regulated and not as scary as it sounds. We go through the consent form with this patient, who has a history of drug abuse. We don't know everything about this new medication, but one thing we do know is that using cocaine while taking this drug will make your heart explode, in layman's terms. This patient promises they're off the sauce and that they totally won't do cocaine while they are on the trial. 2 weeks later they relapse and, well, you can figure out the rest of the story. Spontaneous heart detonation is a serious condition. If you or a loved one have been affected by spontaneous heart detonation, please reach out to Hamlin Medical immediately. My brother did a rotation in an ER before med school. Paramedics brought in a man with a lacerated neck. He was drunk and fell into a fish tank. His drunk buddies called 911. When the paramedics arrived, they realized his drunk friends had put a very tight tourniquet around his neck to stop the bleeding. Edit. I texted my brother to remind him about it. It happened almost 20 years ago. Apparently it was worse than I remembered. The guy and his buddies were doing drunk WWE. He had a 2-inch glass shard stuck in his head, in addition to the neck laceration. Dude came into the ER with no idea the glass was there. 4 different firefighters had to hold him down as he screamed sexist remarks at the female doctor. He said when they removed the glass, blood shot about 10 feet in the air. My brother at that point silently noped the hell out of medicine. He went on to attend Berkeley Music School and is living his best life as a musical producer and engineer, and is not arguing with rednecks about whether or not there is a glass shard in their head. Former practicing surgeon. Male came in with a small bowling pin up his backside, for the 3rd time. The old 3-strike policy. Pet nurse. The things that come out of parents' mouths daily is mind-blowing to think they are responsible for the welfare of babies and children. 2 days ago I listened to a conversation between the ICU doctor and AMP, a dad who insisted that his newborn, his 2nd child, needs to be given water, tap water, in addition to his formula because the human body is made up of mostly water, so how is a baby supposed to survive with no water? That's what they had been giving the baby at home. We figured out the cause of the baby's electrolyte imbalances. Another parent brought their kid in who was severely underweight and had a tube for feeding. Upon further discussion, the parents said when the baby cries or seems gassy, they just open the tub and hold him over the sink, and once all that extra stuff comes out he stops crying and feels better. They were feeding the baby, then immediately letting all the formula in his stomach run down the drain before he could digest it. Unrelated, but gives a little context, the child's full name was also a Star Wars character. Deleted. Dentist here. Once a stressed receptionist asked me to help her interpret a call. I thought maybe the patient was speaking some foreign language. No. She just wanted me to confirm that the patient was asking for his property back, that we took from him last year. Last year actually being 4 years ago, but I guess time flies. And his property being a tooth we sent to grind into slides for analysis. While explaining that it was impossible for us to return his tooth, he started going on about his rights and his property. When I tell people to move their jaw to the side, they always ask which jaw. Actually not everyone, only adults. Children get the assignment. SMH. I worked IMS for years. It never ceased to amaze me the things people will do to themselves or others for fun. Confronted with these types, my first question was always, at what point did this seem like a good idea? The weirdest one I can remember was a guy that put his penis through a large metal nut. Once he got erect, he couldn't get it off. Everyone needs to nut sometimes. A family member's worked at a hospital and had a patient come in with really strange physical and seemingly neurological issues. Couldn't figure out what was causing it. Didn't match anything he knew of and tests were inconclusive. He asked her to walk him through her day. Turns out she was drinking a cup of bleach a day and bathing in it to keep clean and healthy her whole life. Same with her family, who all died very young. She could not accept that drinking bleach was bad for her health. This one. I've been reading through the comments for hours. This is the one that made me go no fucking way. Take my poor metal. I worked ED for 10 years. Every day people come in and it shocks you how they manage to evade death for that long. One of the worst was we had a guy come in. He was a twin. He told us he needed to get checked for STDs because his sister apparently just got one. We of course had to ask if he has had sex with her and he said no, but they were twins, so what she has, so does he. After a collective sigh of relief that this wasn't some weird Alabama you're my sister shit, we had to educate him that is not how it worked at all. LMAO, he must have been so confused as to why you asked if he had sex with her. Someone asked me how you catch a stroke. This is as the partner of said person was on the floor unable to stand due to left-sided weakness, no power. They both thought he could sleep it off overnight and be fine in the morning. 12 hours later they decided they'd phone the doctors to ask if there was anything the DR could give the person on the floor who was also now incontinent. They didn't even get worried during the previous day when his face drooped on the left side and he was slurring his speech. I said he has had a stroke. Oh, how do you catch one of those? My wife was in a meeting with a doctor who had a patient argue that she does eat vegetables because she always has ketchup on her cheeseburgers. Had a patient when I was a pharmacy resident get repeatedly admitted to the hospital due to CHF complications, shortness of breath, fluid overload, etc. She had been advised to follow a low sodium diet, but no one had asked her what she had actually been eating. I asked what she usually ate for lunch and she said instant ramen noodles every day, but she only added the seasoning packet and a little salt. Pregnant, smoking crack on a public sidewalk and twists her ankle. Decides to call the police for help and then continues to smoke crack as they arrive. Police then promptly arrest her, and she becomes my patient. Honestly, that's the best thing that could have happened for the sake of the baby. Twisting her ankle probably saved that baby from further drug exposure. Diabetic patient with foot ulcers that kept being infected with a lot of different gut microbes. Turned out he used to put his foot in the toilet and scrub the open ulcers with the toilet brush. What a terrible day to have eyes and literacy skills. Plenty, although the one that always sticks in my mind is a patient I met during my early years on a palliative care ward suffering from terminal cancer. She was only in her early 30s, and the only reason she had gotten so far gone was that she had relied on the healing power of crystals rather than, chemotherapy. Saw a similar story but worse because it was a child with cancer and parents who were convinced some vitamins would help. So basically the child just suffered and went on palliative. Admittedly, with chemo, survival rate was about 20%, but I still can't get over that they didn't even try because their vitamins would do everything. M's checking in. Late 20s male called 911 for a mild headache. No alarming symptoms. Middle of allergy season. Being good medics, we check all the things. Totally normal vitals. No fever, no medical history. Just a mild headache that started about 30 minutes prior. Do he take Tylenol or ibuprofen or anything? Nope. He wanted to go to the ER to let the doctors handle it. Imagine the bills. If you're gonna pay $1,500 for an Uber ride, at least go somewhere more entertaining. My dad, who lives by himself, had a stroke. He did not go to the hospital. 5 days later he called me sister and said he wasn't feeling well. She took him to the ER. That doctor said that him not taking his blood pressure medicine probably saved his life as blood was able to push past the clot. My dad still has a slur. He still thinks he's doing okay living on his own. Optometrist here. If I had a nickel for every time someone said they use urine for eye drops, I would have $0.10. Which is not a lot, but it's weird that it happened twice. Once is weird enough, but twice? What the hell? Wouldn't that sting? I used to be a surgical technologist and have since moved up. One time, some guy thought it would be funny to pretend to have a seizure right as we administered anesthesia. He apparently looked up malignant hypothermia, which is a severe action to anesthesia that could end in death. And as he was going under, we couldn't wake him, so we had to bring the crash cart out and call a code blue and the O to get this guy up. We did not do his elective surgery after that. Oh, this is a very special level of stupid, like joking about bombs and that's a line. I'm not a medic but an environmental health officer that investigates infectious disease, sources, causes, exposure. I had a case in a 2-month-old of Campylobacter, food waterborne poisoning. The mother called me and asked how could she get it when it comes from chicken and she's vegan. When I say vegan, the mother meant they were treating the baby as vegan. No breastfeeding or milk substitute. Proper boiled my piss, that one. Edit, by milk substitute I meant breast milk substitute as in formula, to make that clear. Wait, so what were they feeding the baby?